Hello, mate.
Hello, how you doing?
I'm all right, mate. How are you?
Yeah, I'm very good. Thank you very much.
So this week we've got Charmaine, continence consultant, who we've mentioned a few times on the podcast and never actually managed to get you on. Completely our fault, by the way.
Yeah, 100%.
But you're here. Thank you for coming.
Yeah, I'm very excited about being here, to be honest.
Good. So are we. I think just before we were talking, weren't we? And it's always nice to have people on the podcast and just learn about their lives and their children and stuff. But we're genuinely excited because Andy and I have both got children that are kind of at that age where we're wondering, is it time to start yet? So we're genuinely hoping we're going to get some little nuggets of information from you to help us kind of move forward with our kids.
Yeah, definitely.
Right, I think it'd be good just to get a bit of background, Charmaine, how you became the continence consultant.
Yeah, so I qualified as a nurse. So I'm my nursing background. So I'm a learning disability nurse, and I'm also a community nurse specialist for children with a learning disability and complex needs. And I qualified. Oh, when did I qualify? 94. So it's a little while ago, 1994. And so I've been working with children, young people, as well as adults as well, for like over 30 years. And then I'd been in the NHS and I'd been supporting children and families, and I'd got to the point where I was just like, I want to be able to support the whole child, not just one particular part. And I was in a situation where, or in several situations where I needed to basically, I could only look at one need, and I was told to then discharge families, even though I could see that there was another need that I could help with, but I needed to discharge, and then families then needed to go back on a waiting list and then re-refer in, and then that whole process started all over again. And I was like, this is crazy. I don't want to be part of this anymore. So that's why I started up with I started Clear Steps Consultancy 10 years ago. For that reason, I just wanted to be able to help more children and families. So so I support anything to do with wee, poo, toileting in the day and night, as well as sleep, understanding emotions, because they're all connected by the gut health. That's what I focus on. I help with toileting, sleep, and emotions and behaviour. So yeah.
Fantastic. I guess kind of one question I was saying to kind of Gaz off air is, why is there kind of a major issue, or however you want to put it, with autistic children and toilet training? It'd be great to get a bit of an understanding as to what's going on there and why it's so common.
Yeah, so there's several reasons for that. So with some of our children, it can be because of the types of foods that our children are eating. So naturally, the fibre content, the range of foods that they're eating can then mean that there's like a slower transit for like those poos to sort of go around in the body. More recent research has come out that they are looking at the gut biome. So in the body, we have microbacteria that's in the body. So we have a mixture of good and bad bacteria, and we sort of have that sort of 60-40, 60-30, that sort of ratio. It's not 50-50. And we need good and bad bacteria. So for some of our children, and the research is suggesting, so it's more established obviously in the States, and here we're doing a lot of research as well, and there's lots of studies that have been done around that bacteria being an imbalance with a lot of our autistic children. And therefore, when there's more bad bacteria that's in the body, it then means that it's more difficult to break the food up and for that to allow to then pass through the body. So this is why you get that, more prevalent to be in sort of constipation and other sort of poo difficulties.
So that imbalance then, so is it purely down to what they're eating, or is there any kind of with autism? Is there any kind of genetic aspect to that at all?
That's what they're looking at. So in the States, they're actually doing studies where, so they're trying to almost, it's not the technical term, but it's almost like putting other family members' gut bacteria into the body to then be able to bring that balance up, so that then the body is then able to digest the food and be able to pass that.
Yeah, they're called fecal is it a fecal transplant or something they call it? Yeah. And it changes, because obviously there's a gut-brain connection, isn't there? It changes the things that they want to eat as well. So it changes that and preferences and stuff as well.
Yeah.
That's crazy how like these creatures in your stomach can affect.
So we've got like we've got like, there's thousands of these microbiomes inside the body, and that's, a large majority of those are in the gut, and that's why they say that that's like our second brain, because that's sort of, when we're thinking about that gut brain connection, we're thinking about, what's happening inside the tummies directly influence our children's thoughts and feelings. Equally, our children's thoughts and feelings are directly influencing their gut as well. So if our children are then in a situation where they don't feel safe, comfortable, regulated, that's then going to affect how and when they poo, for instance.
Wow.
That's nuts. So again, like it'd be easy to think that coming and speaking to you, that you're just going to talk about, if you see your child do this, then now you need to do this, and then you need to do this. But there's so much more that you have to account for.
Yeah. So that's when we were thinking, when you're thinking about toileting and how to progress, or where do you start, a lot of people just say, oh, all you got to do is just sit the child on the toilet. No,
Yes.
don't even start there. Because surprisingly, all the families that I speak to have all tried that, and it hasn't necessarily gone to plan. But that's not where we start. We have to start inside the body. We need to help our children's inside body to be able to get that regulated, calm, and then be able to then move on to that next stage.
So things like the probiotic supplements, good?
Yeah, so when we're looking at those, we're looking at prebiotics, probiotic, and postbiotics. So it's not just
I didn't realise there was that many.
Yeah, so it's not just sort of like, we'll just have that and then we'll just go with it. But so it is looking at those type of things as well. But it's not, it's like anything that we sort of talk about today, especially. It's not, we don't just say, right, that's it, we just got to focus on that. Because what I've found is it's almost like a layered effect. Like that's just one part that we need to look at the gut health, but there's also other things. Do you see what I mean? It's not just one thing. But that is one of them.
Okay. So there's prebiotics, probiotics, and postbiotics.
Yeah.
Okay.
So, and what that's doing is it's all about sort of the number of microbiomes in the body. So it's about sort of building that number of microbiomes in the body. It's making sure that you've got enough of the good bacteria. So that's the other sort of side of things, as well as sort of like regulating those. So we're looking at those microbiomes in the body.
Wow. Because I think with Lydia, we've got a box with sachets, which are from Boots, I believe.
Yeah.
And they're just probiotics.
Okay. So what's the difference between a pre and a pro? Is that, obviously one's before and the other one you...
Yeah, so we're looking at like the number of microbiomes, and we want to make sure that we've got a number of the good microbiomes. So that's what we're trying to do. It's almost like, I suppose you're thinking about preparing the body, and then you're actually, making sure that inside body is all okay.
Okay, so sorry, we will move off this in a minute. I'm just a bit of a geek.
Okay.
So probiotics.
I think it's fascinating, though, don't you?
yeah, totally. So is a prebiotic essentially food for the bacteria that's already there, or does it actually contain the bacteria itself?
It contains the bacteria. So when you're sort of thinking about like the live like when you've got like live. So my words are going to go again today, aren't they?
Oh, like yogurts and stuff like that.
Yeah, that type
The
of thing. So
cultures.
Yeah.
yes, thank you. Yeah.
Okay. Okay. Right. So I'm just going to use Thomas as an example, and actually Lydia's what, a year and a half, 2 years behind.
She's 5.
Okay.
Yeah.
So Thomas is going to be 7 in July. He's still in nappies. We have sat him on the toilet and gone wee wees and poo poos and like not really knowing what we're doing. We're just kind of hoping one day he's going to click. Like, let's assume that the probiotics, prebiotics, and the food he's having is spot on. What kind of, is it the same with typical children where you're looking for signs of when to start?
So typical sort of traditional toilet training will have you believe that you need to do it by a certain age, that you're looking for certain signs, and it's just like a tick box exercise, and we're just training our children to do X, Y, Z. That's what we need to do. Whereas what I promote and what I try and encourage is that we're looking to help our children do more of toilet learning. So we're looking for them to learn to recognise, understand and respond to those messages inside the body. So when we're sort of we're starting inside the body, and one of the first things we need to look at is what type of poo that our children are passing. So that's why we don't start on the toilet. We're just looking at what sort of poos that they're passing, because that tells us what's actually happening with that microbiome, how the microbacteria is actually working. That's like a window to our inside body by just looking at the poo. So when we're thinking about poo, which I talk a lot about poo, but when we think about poo, we're thinking about the Bristol stool chart. And according to the Bristol stool chart, there's 7 different types of poos, and they may not always look like the same, as in the same colour or sometimes the same shape, but they're roughly like, that's what we're sort of looking at. And then by just looking at those poos, then we'll know whether our children need a little bit more help inside, and I suppose that's what we would sort of be looking at as like a sign of whether our children are, I wouldn't say that like that's a sign to say they're ready, but that's the sign that, okay, right, we'll start with the poo. If the poo's all doing what it's meant to be doing, great. Okay, now we can start the next stage.
Goodness me.
Okay, so what is the next stage?
So the first thing we need, is it all right if I show you? It's not a real poo,
100%.
by the way.
Oh, okay.
Not a real
That's all
poo.
right. We've as autism parents, we've handled a lot of poo.
Oh,
Yeah, so we're just looking for a nice smooth, obviously it doesn't come with a cape and eyes, but although I have
Oh.
said that in training sometimes, and people are going, well, actually, my child has swallowed some googly eyes, and actually it has arrived. But yeah, so we're looking at a type 4 medium poo, according to the Bristol stool chart. So that's
Okay.
what we're looking at.
Okay.
So once
Yeah.
we've got to that type 4 medium poo, we then know that the gut bacteria and everything is doing what it's meant to be doing. So that's where it all sort of comes
'cause-
back.
Because Lydia's are very soft, shall we say?
are they?
Yeah.
Thomas's were, but it was because we were giving him dairy, like the smallest amounts of dairy, and he has got an intolerance. And we kind of thought, well, he's not having milk, so we'll be okay. But like the tiniest amount of dairy made a huge difference to what his poo was like. We stopped that, and almost overnight, it just went back to how it should be. Okay, so assuming we've got type 4 poos, I never thought I would say type 4 poo. Assuming we've got
There's
a
a
type
first
4
for
poo.
everything, isn't there?
Exactly, type 4 poo. I'll be going back like saying to Mish, did a type 4 poo. She'd be like, thanks, what are you talking about?
But you can. I've seen this before. You can go on Google. You can search the name of the chart.
Bristol. So do you want me to
Bristol.
show you
Bristol,
the
yeah.
Bristol? I've got a copy if you want.
Oh, yeah.
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 And all parents.
Here's one
can
I
kind
prepared
of,
earlier, isn't it?
That's it. That's the one.
Yeah, I've had all of them.
Yeah. So we're
Yeah.
looking for our medium type 4 poo just here.
Okay.
That's what we're looking for.
Yeah.
So
Yeah, I think we're at the porridge stage.
yeah, but this yeah.
Okay.
So, and what we sometimes find is that sometimes we can find that our children are passing this. So then we like sort of, like you said, are we looking at like an intolerance, that type of thing, or is this the only poo? Because sometimes we sort of see this, and then when we're not really thinking about it, we're just in the motion and just thinking, let's just get rid of it. We don't need to think about it anymore. We don't realise that maybe there could be something else as well.
Yeah, we've had a mixture of some of the harder poos as well.
Yeah. So when we're sort of looking at this type of thing, so anything sort of like type 1, 2 or 3, and our type 3 doesn't necessarily have to be a sausage. Sometimes I work with a lot of families where it's more round. And what that's showing is that there's like a build up inside, and when you have a build up, so if you can imagine that's like a build up, you then have this softer poo that will then come around it. So you tend to see the softer poo, but actually there's this build up in here.
That's still there.
And then if there's a build up, it then means that the rectum is like stretched inside, and that kind of blocks the messages for our children to actually feel when they need to go through a poo.
I can imagine that's very uncomfortable as well.
It's uncomfortable, but for a lot of our autistic children, it actually means that they don't actually feel that. So sometimes I've worked with lots of different families, and sometimes they've actually had sort of like X-rays and things like that to sort of see what's happening, and the child seems like they're going every day, everything seems okay, but actually we just need to get to the bottom of this, have an X-ray, and they're completely impacted. But the child is not showing any signs of that. And that's why we always start inside the body. Just monitoring those poos actually shows so much, and you don't have to go through the X-ray, because obviously for a lot of our children it's not something that we just go and have an X-ray, do we?
No,
it's not something that we do.
Not.
So yeah, but you don't
Definitely
even have to get to that stage. So
okay, so assuming we've got a type 4 poo.
Yep.
What's next? How do we get them to go to the next stage of? Because the reason I ask is, like, Thomas, he knows when he's going to poo. The signals are all there because he takes himself away. And this is another one, slight tangent. He's still, and I don't know why I was surprised, but he still wants privacy, even when he's doing it in his nappy. So he'll take himself away, and if you like walk past the bedroom door, he's like, leave me alone, I want privacy. So he knows when he's going to do it. He wants privacy when he does it, but it's just that
in
next stage is
in the nappy.
Yeah.
It's just in the nappy, yeah. So that's why we always come back to that first stage, because when our children are taking themselves off somewhere, it's because it's almost trying to like reduce how that's feeling outside of their body as well as inside, because inside it may be just like, because their brain is going to be like trying to understand what's going on inside, and they've got a lot to process anyway. And then if they know that they need to get that poo out, they try and take themselves off somewhere so they can then try and reduce that, how much more information that they've then got to process. So that's why they take themselves off. And then if, like you say, you walk past or just happen to hear you, or sometimes our children will have a certain circumstances, like it has to be in the corner, facing the corner at, I'm working with families at the moment where children are laying like horizontal, like on their tummies in the corner, at the side of the rooms. I've got other families where the children will take themselves off to the toy box. Other families, they're outside. Certain circumstances, it could all be different, but it's all coming back to that same, what's happening inside. They're trying to process all that information, and they're trying to reduce that
makes
as much
sense.
as possible.
So he's essentially taking himself away because he's trying to reduce the input.
Yeah, that
from the
sensory
outside. Okay.
overload that he's receiving. Yeah.
Okay, that makes total sense.
And that's slightly different to Lydia, where she does none of that.
No,
You
just
just be
removes it.
walking in the front room, and then it just happens there.
Yeah.
Crazy.
Well, they're all different.
Yeah.
So,
And that could
okay,
be like
so,
what we were saying before, like when
Yeah.
if you have, that's why we sort of like to know what the patterns are, because if we sort of identify pretending like this is a poo, by the way, if we're pretending that there's a poo and there's like a build up, it then means that she may struggle to actually feel that, and then you'll just end up with, it's not just small amounts that can come out, it can be it looks like an actual poo that's being passed, and have no feeling that has actually passed at that point. But the good news is with all of that it can come, and you can progress from that, but it's making sure that we have the right starting point for each of our children, because like you say, it's even with yourselves, they're very, very different situations, but we still need to make sure we've looked at that starting point.
okay. This is so interesting. Tell Mish when I get back. My wife was very excited because she's like, "Ooh, because," and anyone like that's listening or watching this, like it does, and this is why obviously you help so many people. Like a lot of us just kind of feel like we hit a wall, and there's some parents that have got children that are teenagers, and we've got much younger children, and there is a fear that we don't know if we're ever going to get over that hurdle. Or if we do, when is it going to be? And so speaking to you is super, super interesting. Okay. I'm trying to play this through.
Yeah, so going on from that then, so we're at that stage. I mean, what are some of the mistakes that parents commonly make when they want to start the process?
First of all, nobody makes mistakes. Just going to say
There
that.
we go.
I knew you were going to say that.
No, because I just think, parents aren't making mistakes. They're just going on information that they are being told.
100%.
And a lot of that
Yep.
information is being fed by the media. And it's a lot of misinformation and a lot of based on our neurotypical children that, based on the fact that, when we reach like an age, for instance, that all children should be potty and toilet trained by between 18 months and 2 years. Well, that's based on the fact that between the ages of 18 months and 2 years, that our children's bladders will stretch and their rectums will stretch, and then their brains will be able to recognize those sensations. But that isn't about an age for everybody. It's just that sometimes people may not recognize that until they are 5. Maybe not until they are 6. Maybe because of what we've just talked about, there's actually something preventing them from recognizing it. So it's not necessarily that they're getting, and when you look at the media, there's a lot of things there that are saying, all you've got to do is start at 18 months, 2 years. Why hasn't your child not started? You should be able to just sit your child on the toilet, when actually some of our children may be struggling with some of their sensory processing differences, and actually the sensation of the toilet seat, their proprioception, being able to actually sit comfortably in that position. Sometimes our children actually find it difficult to sit long enough for anything to actually be passed. It's sort of there and you're off. And actually, and that's what we were saying, that's what I meant earlier, when we have to start where our children are. So if our children are struggling to regulate their body to sit long enough, then that's where we need to start with our children to be able to help them regulate. So that's why when you so they're not mistakes, but they're misinformation, that it's more of a general information. 18 months, sit them on the toilet or the potty, remove the nappy. And when we're thinking about our autistic children, actually that we're not meeting any of that, but just removing the nappy is actually going to make them feel more uncomfortable and not safe. And actually that isn't what we would do either. So you have to really look at where our children are and what is right for our individual children.
there's so many misconceptions, isn't there? Because I've heard, again, people trying to give advice, and like, I understand why they're giving advice, going, well, what you need to do is remove the nappy, just put them in pants, and then the sensation of being wet or, you know, whatever else will start to click, and they won't want to do that, and you can train them to use a toilet. There's so much stuff out there, which I can understand why parents get completely overloaded.
Yeah.
And as you say, right, recently with what's, you know, a certain social media star said, there's a lot of ridicule from people that don't understand, which puts additional pressure on parents going, goodness gracious, my child's 5, 6, 7, 8, and they're still in nappies, and, you know, there's that kind of almost shame feeling that comes into it as well, which puts additional pressure on.
Yeah. And that whole sort of blame culture that seems to be, you know, like, this is what you're meant to do, because it's down to that whole training. And if you're not doing X, Y, Z, therefore it's your fault. It's your fault as a parent, and it's your fault as a child. And that's not true, because all that means is that a child is not about training them. It's about that they're learning. They're on that journey. So actually, if you look at it, that our children are learning to recognise those signals. If they're not able to do that, that means we're at that stage. If they are able to recognise, then we're on the understanding part. So then we move on to, we've recognised those signals. We're now on the understanding part. Now, I've got this feeling. What do I do with this feeling? Where does it go? Yeah. And then that's where we go to that next part. But just going straight in there with, that's what you do, it's not, you know, and that's where the blame bit comes, because it's like, well, you're not doing it, therefore it's your fault. And so
we need to get to the understanding part. We can't just keep placing them on the toilet every 5 minutes and
and actually that's going to do
lucky strike, shall we say?
Yeah, and that's what other people say, that you know, just keep putting them on the toilet, they'll get it in there eventually. But actually, if, like for wheeze, for instance, if you keep putting our children on the potty or the toilet, it means that their bladder is not going to fill. And if their bladder is not full, it means it doesn't stretch, and then they can't recognise the feeling. Do you see what I mean?
There's a lot of science behind this. I guess we don't really think about it, because we're like, I'm going to the loo.
No, exactly.
That's it, isn't it? Yeah.
But then when you break it down for our children, there's, you know, when you just sort of think, all you've got to do is just go to the toilet. But actually, you've got to think, well, I've got to recognise that feeling. I've got to understand what that means. And then I've got to respond by going in the right place at the right time to get that out.
Yeah.
But I break it all down. So I know that sounds overwhelming, sorry. But I break it all down, make it sound really simple. And that's why I always say start inside and then we work outside. Because that'll just...
I remember, like, I remember how excited we were just when Thomas recognised that the nappies were in the toilet. So like we were trying to like build a connection in some way that, okay, the place where the toilet is, we hadn't tried putting them on the toilet. We were just putting the nappies next to the toilet. So we were trying to build this connection with toileting and that room. So like now if he needs a nappy change or something, he'll just go and get a nappy from next to the toilet, and then he'll bring it to us, and then we change him in the same room. But we don't know what to do next, and I'm guessing I could ask you that question all day long, but like you just said earlier, like it's different for every child, isn't it?
It is.
It depends where that child's at.
There is certain things that we would look at. Like I say, we're looking at that recognising first. So we want to make sure 100% we've got, you know, that's the first sign. Then we want that understanding. So like you say, in the right room, in the right place. And then we break that down even further, that it's making sure that our children are actually feeling safe in that place as well. And when we sort of talk about safe, it's not saying trips and hazards and, you know, not going to fall over, that type of thing. We're talking about safe inside our body. And for some of our children, the bathroom and toilet isn't always a safe place for them. And that could be because of like the sensory side of things. So it could be it's quite bright, it could be the echoey, it could be the smell. You know, there's lots of different reasons. And then what we do is we try and break that all down to identify what makes the child more comfortable to be in that place. So it's sort of breaking it down in sort of stages. That's what we do.
And with that, again, things that are thrown out. Should we be using rewards if they do go to the toilets with neurotypical or neurodiverse children, or is this kind of a false thing that's put out there?
So there's a lot of things out there that say about all you need to do is just give a reward. I've actually worked with families where other professionals have advised autistic children to have rewards and just said the reward isn't big enough. So I've worked with families where the reward started off with, like a small car or something. They then went to the biggest Lego set that you could ever imagine, and surprisingly it didn't happen. And then the professional said, well, what is it that you really want? What is the child really wants? And this particular child was verbal, and they said, oh, I really want a new bed. So they said, this is what you've got to do, Mum and Dad. You've got to get them a new bed. So the family followed this professional's advice and brought them a new bed. Surprisingly,
when does that
work.
end?
Exactly.
Yeah.
So it's not about
Ferrari.
Yeah.
Yeah, we just make a shopping list, shall we?
But
The thing is, though, when we're thinking about rewards, it's going back to that sort of behavioural approach, and it's that we're sort of that cause and effect. And what we're assuming is that a child is not pooing or not weeing in the toilet on purpose.
Yeah.
So when we're thinking about pooing and weeing, we're actually saying it's because we're wanting them to recognise the signals, and they're not doing it because they're not able to recognise those signals or understand that. And it doesn't matter how many rewards that we give our children, it's not going to work. So,
no,
for our
if you don't know what you're being rewarded for.
No.
Right. Okay. That's a really good point. Actually, it's not that they're choosing not to do it. They don't know that that's even on the cards, do they?
Yeah. And so often, yeah,
Okay.
exactly. And so often, I work with lots of families where they'll say, though they definitely know that they're going, like if they're soiling like consistently, and what can happen is that they don't know that the poo is coming in the body because they can't feel it stretching. What they're actually feeling is that the bottom cheeks, the actual poo is coming in between the bottom cheeks, and that's what they're responding to, as opposed to the stretching. Like your eye will be like, we'll feel the stretching inside, and that will tell a message to our brain that says, you need to go for a poo now. And we'll go, all right then, off we go. Whereas our children, they might not feel that. They'll actually feel it coming in between. And what you see is, quick, I've got to hold that on to, and then you get to the right place.
Oh, goodness me. So, yeah, a lot of children could just be, again, blocked, shall we say. And I think last time I went to the paediatrician with Lydia, this came up in a discussion, and I think they administered, I can't remember what it was now, some sort of medication or whatever it was, but the way they explained it was it would go into the system and it would almost tackle the blockage from the outside in, almost like a corkscrew effect on it. And they were saying, yeah, you may notice things get runnier before they get better.
So that would be sort of
breaking that down.
Yeah.
Okay.
Yeah. So there's lots of different medications. So laxative medication. So there's some medications where you have macrogol medications, which would be like your Movicol, your Laxido, Cosmicol, that type of medication, and that's like water to the large bowel, and it breaks any poo that's built up and in the rectum as well. And then you have like your stimulants. So you've got your Senna and Postcode, that type of thing, and then you've got your lactulose, like your softeners. But yeah, it's the macrogol medications, so like the Cosmicol, Movicol, that type of thing. But it's always making, sometimes families can be prescribed the right medication if the child is like impacted, but it's not always shared in the right way. Because sometimes it's just sort of like, take a sachet, take 2 sachets, and I always describe it which I don't want you to think too closely about it, but I describe it a bit like a poo in a water flume. So obviously we wouldn't want to have a poo in a water flume. But if you did have a poo in a water flume, you'd have the medication that would be the water. And if you had like one sachet, it may just sort of not quite reach the poo. If you had like 2 sachets, it may reach the poo, but the poo's not going anywhere. Whereas you actually need a lot more to actually push that poo all the way through. So obviously nobody wants poo in the water flume, but to try and explain it.
Definitely not. Oh, sorry, mate. Do you have one?
Yeah, I was just saying. So with that as well, we hear stories of a child doing really well and starting to get used to going to the toilet, and then there's suddenly a regression. Is that something you've come across as well?
Regression is it's an interesting one, that one, because what I tend to see is that it's not always a regression, it's something that's always been there. So when we have been talking about poo, and obviously we're talking about that a lot today, when we're talking about poo, it's almost like poo is like a cycle. So for a lot of families, I've had in the past where families have contacted me and said, oh my goodness, things are really difficult at the moment, we really need your help. So I'm like, yep, that's fine, I can see you next week or the week after. And then all of a sudden they message and say, no, everything's okay now, we're, all the poos are all okay. So you're like, okay, I'm here if you need me. So, and then a few weeks later they come back again, and then it's just that cycle. So what happens with poo is you can go in a cycle of like passing, your type 4 poo, and then all of a sudden you could have like really loose poo or different types of poo, and it becomes a little bit more tricky, and then it can go in a cycle again. But the thing to remember with poo is that's why we do like the monitoring, is because it doesn't go away, it just changes. So it might be that, so I see families where it might be they have passed like an incredibly large poo, like, oh my goodness, it's blocked the toilet system, we've got wire coat hangers, it's huge. And the families are like, oh my goodness, how's that even possible for a small 4-year-old or a 3-year-old to pass that sort of poo? And then all of a sudden they're passing sort of what they think is like normal sort of poo again. So you can have that sort of cycle, that you can sort of have that, and then you can have a looser poo, but it doesn't go away. It's just building up inside.
That's me.
Yeah, that totally makes sense. Like if you build a routine on a type 4 poo, you could totally understand that would completely get thrown off when that changes. Either way, close to a type 1. How many types are there? 8?
7.
7.
That is the worst bingo card ever.
I have actually done some games and things where people have actually had to find the pictures to match them. Children really enjoy it, though.
Yeah, I can imagine they do, actually.
Yeah.
Is there what's the support like with the NHS for stuff like this? To the kind of granular detail that you provide it? Non-existent.
So we've got the continence service, and families. Some of the families that I work with have waited quite a while to get to see the continence service, and they will then sort of do an assessment, and then see whether you need to have the constipation service. So then you might have waited for the continence service, which, depending on which area you're in, you may be able to be supported in the continence service, or you may then be referred on to the constipation clinic to then be able to be seen in that way. A lot of families say that it's like a postcode lottery for some families. So some families are saying, I've had an amazing support from my continence team, they've been amazing. Other families have said they've really struggled because staffing numbers have been quite low. Continence teams in some areas are looking at more product providing, so providing nappies, slips, pull-ups to help manage, as opposed to having the time and the resources to help families through. But it's a
Yeah.
postcode lottery. It's, everybody out there is wanting to help, but I think what I'm finding is that a lot of our autistic families are struggling because they're trying to share those traditional methods in some ways, and it's not always coming across, that more individual approach that a lot of our families need.
Yeah.
So
And
the
and
support is there. There is support out there, um, but it's trying to sort of filter through that more neuroaffirming, sensory friendly, nervous system friendly, you know, autistic friendly approaches is
Yeah.
what we're trying to
yeah,
Yeah.
encourage.
and and I guess this has a knock-on effect in everything, doesn't it? So if you have a child that is constipated or is not having the right or the correct sort of poo, that's going to affect behavior, sleep, anxiety, which then knocks into something else and something else. So this is part of a wider thing then.
Yeah, yeah. So if our children are struggling with the poos, it can influence how and when they sleep, and obviously how and when they sleep then obviously influences their sort of like window of tolerance when we're thinking about emotion regulation, their sensory processing, them being able to access their executive function. So when you're thinking about executive function, we're thinking about our children being able to follow the sequence of events, know what comes next, that type of thing. And if their body is trying to work out whether their body feels safe, comfortable, that sort of thing, they can't actually access that. So that then makes, that's why it becomes really tricky when we're looking, to just put in toilet training, which is why you need to look at where our children are on that journey.
Definitely. And is there a point where a parent should seek medical attention? Does it ever get to the point where this is beyond just waiting for an appointment, that you should actually seek medical attention?
Yeah, so when we're thinking about sort of poos, we're thinking about poos that need to be passed either 3 times a day or 3 or 4 times a week. If you're in a situation where your child is, going more than 3 or 4 days without passing a poo, then we obviously need to get medical. We need to sort of see your GP in the first instance, just to sort of check out to see what's sort of happening. So,
Okay. All right. Now, in a perfect world, right, what should I now be looking out for Thomas? Right, just Thomas as an example. He has awareness of when he wants to go because he takes himself away. He's assuming he's comfortable in the bathroom, in the toilet, but that's a really interesting point, because although he goes in there, does he actually feel 100% safe in there? I don't know. But assuming a child then feels safe in the environment, what's the next kind of stage? I realise these are probably quite difficult questions because I'm asking you for quite a broad answer for a specific case. I know people are going to be screaming at me going, ask this.
So we start with recognising, we then do the understanding. So once you're in the right place, we then want to try and help our children to get those poos in the right area, but not actually sitting on the toilet.
Oh. Okay. Okay. How'd you do that?
So again, it's child specific, so it's not sort of general for everybody.
Yeah.
So for some of our children, so if I give you some examples, no names mentioned, obviously,
No, of course.
of some families that I'm working with. So they had a very similar situation where their child would only poo in the nappy in a certain place. We then managed to get them, they would then poo in the nappy in the bathroom. So that was the next sort of stage that they did then. Then they wanted to be able to poo on the toilet. So then they were sitting with progress. Obviously, it's not just like day one we do this,
No. Yeah.
there's little steps
Yeah.
in between here.
Of course.
But then
of course,
we're then
yeah.
looking at sitting on the toilet, but in the nappy. So lids down, sitting on the toilet, just feeling comfortable to do that. And then gradually, so now with this particular family, we're now at the stage where, so they'd then gone to the point where so if you could imagine, okay, I'm not very good at doing this. So if you could imagine this was the pull-up, so you've got like the tabs
Yep.
either side, so that's the pull-up. They then had ripped either side, so then they had it between them and they were holding, so they were like holding like for dear life, literally holding on
Okay.
to the while they were pooing, but it was almost.
Okay.
So now we're at the stage where it's there, most of it is going into the toilet, and the family are just like, oh my god, we're just like really
Yeah, I'll bet.
excited. So, but yeah, it's not like it's, there's stages in between, but it just gives you an idea of how we sort of break down.
Yeah.
So it's a gradual process, isn't it? It sounds like
Some
you're
of our
gonna have to
children
be,
can
as a
just sort
parent,
of, yeah, some may sort of like just go from one to like into the bathroom. It's like, to some it's a natural progression for them, but others may need a little bit of support to get to the bathroom. Do you see what I mean?
Yeah.
That makes, yeah.
and it's having patience and that consistency
Yeah.
to see it out rather than today I'm not feeling like it.
Yeah, so you're placing, you've got like the standard steps, whatever they are, but you're essentially adding as many steps are necessary for that specific child in between those typical steps. So like even there, like I know Thomas would be the same, where they need to feel like they're doing it in the nappy. So you would take the sides off, but still hold it, so the feeling of the nappy still being on is still there. And then gradually move that further and further away from them every time. Like, I'm just trying to think with Thomas what I might try with Thomas, but okay, that makes sense. You're really helping them by just putting all these additional
And it all
little
comes
steps
from
into-
them feeling safe in
Safe,
themselves. Because if
And I
they
think that's
don't
really
feel
important,
safe-
isn't it? Because you could be creating, depending on how you go about it, you could be then creating kind of almost anxiety and pressure on a child.
don't
to
remove,
do it. So, yeah,
are you
having
going to
that
remove
kind of-
it today? You're removing it today.
Yeah.
There's a lot of
Yeah.
that anxiety. That's why
Which-
you start inside, because if they're not feeling safe to begin with, then actually, just saying, right, today we have decided this is where it can't be led by us. It has to be led by the child.
It's very, because again, in the last episode, remember we were talking about the summer with Thomas, and you, as many parents, and I was going to do the same with Lydia. It was like, right, summer holidays now. We're going to start. We're doing toilet training.
Yeah.
In the summer holidays, and we weren't even considering whether the child was ready based on the steps that you've just mentioned. It'd be
No.
like, right, it's
6
going to be
weeks.
sunny weather. We'll do it outside. We'll
Yeah.
start out. We'll bring it in.
Nappy's off.
Yeah.
Like,
So
Yeah.
everything that we discussed last week
yeah,
is
like,
completely
can't do
against.
that. Because again, I suppose, if you take too much of a lick, because trust is going to be like
Hmm.
safety in the environment, but then trust with you is going to be huge. If they think that you're just going to make them take this giant leap, like psychologically, you could create constipation issues, couldn't you? You could psychologically make
you
it
could
so that
create
they
a-
don't want to go at all
A
because they
fear
don't
of the
know.
bathroom.
Yeah.
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 And again, just so that if anybody's listening, that isn't the family's fault if that's ever happened, because we get it.
All their
not-
fault.
It's
Stop being
not.
so nice.
It's
It's
not.
all your fault. Joking.
So if
Charmaine
Oh,
is
God,
so
this-
nice and we're brutal. It's all your fault.
this opens up other questions though. So if you are correctly following the steps, working with yourself, Charmaine, or working with another continence consultant who's following very similar steps, and we've obviously learned it's a lot deeper than we initially thought it was going to be. You're doing everything you can, and then the child's at school who are trying to implement something at school.
Oh, dude, such a good point.
Do they always marry up, or do schools have a very different opinion how
Great
this?
question. Yeah.
Obviously, yep.
Such
Yeah,
a
we're
good
gonna get somebody in. We're gonna be
So
working with them.
yeah.
We're taking them to the bathroom.
So what we need to look at is that for a lot of our autistic children, and I say are because my son's autistic as well. So for a lot of our autistic children, it's not easy for them to transfer from one environment to another. So it's almost like, I think I put a post about it recently, where if you may go to your toilet at home may have a pull down handle. You may go to nanny's or grandma's house and that's got a push flush sort of thing. Maybe at school and it's a pull down handle like this. Wherever they are, they've got to learn that toileting in that place. It's not about just you've learnt toileting now, so this is what happens like within the summer holidays. We've learnt toileting, therefore they've learnt toileting. But actually we've then got to help them to learn it at school, and actually do they feel safe in school? Is there something to help them understand that actually, what's the connection between that toilet and this toilet? You and I know that that's a toilet. They're toilets. But that's because we can transfer that information, whereas a lot of our children need help to transfer that information. And that's when we're looking at school, why we often, there's lots of difficulties because families are saying, well, they can do it at home, which they can.
Yeah, that's going to be my next question, yeah.
Yeah, sorry.
No,
that's perfect. I was going to ask you that, and you answered it. So that's
the toileting is like going for a period. I know loads of people who I went to school with who would refuse
to go to school.
Yeah, to go to school. Yeah,
never. Secondary school, nah, not a chance. Arthog, going to Arthog in Wales, nah, held it for a week, wasn't happening. So you can imagine for an autistic child.
Yeah. And
Maybe
you just if you just sort of, obviously don't think about that too closely, but if you think about that, just sort of, when you're thinking about like secondary school, like for us, it's sort of, you're thinking about, are they gonna, there's people outside, can they hear? Can they,
smell it?
Yeah. It's
who's gonna walk in?
Yeah. And that's what we're thinking. And for some of our children, they may not be thinking, oh, what do they think? They may not be, really care about what they think, but they may have their own things that they're actually processing and need to sort of understand and be able to do. It's a fascinating topic, don't you think?
Honestly, it really is. And the other thing that makes it fascinating is it's such a huge issue, for lack of a better word, for families. Obviously, you got an autistic child, and like, it's one of those things that if we could just get past this, our life would be so much easier. Even from a cost point of view, like the cost of nappies and not knowing when that's going to end. It's an issue that not many people talk about necessarily.
Yeah, and just having the conversation today, thinking, we've been doing this podcast now over 12 months and we thought we'd heard everything, but we had my understanding of toilet training. No, I just realised it's so minuscule, compared to
the level of granularity to it. I had no idea.
Which now makes me think back to, again, not to harp on about it, but that kind of some of the stuff you read in the press. We'll go back to kind of Louise Thompson and Made in Chelsea, and the kind of comments about a certain number of children are attending school and not even toilet trained, and kind of the little kind of cheeky grin and a bit of a laughter about it.
Yeah,
it's not as simple as
it's
lazy,
not lazy
parenting.
No,
100%.
And you get a lot of parents who feel completely judged.
Yeah. And if you actually understand like how the body works, and we haven't even gone into how the brain works either, but just, if you understand how the body works, then you wouldn't make comments like that, because then you'd know that actually that child is trying their utmost best to understand what's going on in their body, and the parents are trying beyond trying everything
Yeah.
they can possibly do to try and help their child, and they're doing everything they're told. I mean, I've had some so I do some calls with families, and had some calls recently, and families have been told that, you know, they've been classed as like neurotic parents because they're not doing
Yeah.
Yeah.
well. And I'm just like, that's just so not true. You're doing everything you can, and there's a reason why it's not working, and you know, but they just haven't got to the bottom of, no pun intended, but there's a reason why. There's a reason why
Do you-
these things happen.
Do you find, because this is something I always think about, that when these children finally crack it, is it quite self-rewarding? Do you see that they're like, oh, this is so much better? Or is it a slow process where they're still trying to get used to it, and I kind of preferred it before?
Yeah, there is a part of that where it's that
Yeah.
again, it's that transition.
Yeah.
And for some of our children, it's not just transition from one place to another, it's transition from one activity to another. It's
Yeah.
it can be quite small as well.
Yeah.
But yeah, I mean,
And it's
100%. I mean, there's lots of happy tears here with the parents. We're just
Yeah,
like,
Oh, I can imagine.
yes.
And I guess the other thing to kind of bear in mind is, like, you know, it's not that it's just a case that the child will crack it and that's it then. There's going to be times where it'll go 2 steps back, 1 step forward, you know, all these sort of things, like, oh, we've cracked it
100%,
now. And then it'd be like,
Yeah.
oh no, we're not quite there. So it's always kind of managing those expectations as well.
Yeah, and it's also sort of like thinking about with the weather and things, and obviously sort of, you know, when we sort of have like the summer and we've got those like heat waves and things, what was working when it was like the cooler weather, we also then, you know, maybe they need to drink more, you know, are they having enough? And they may have been having enough to drink when it was the cooler weather, but then when we're thinking about the hotter weather and we're thinking about helping the body, you know, it may not be enough. And then because obviously
You know
then
what?
we're sort of, you know, some of our children are sort of more like mouth breathers, so therefore they're actually, you know, they actually need to drink more because
Yeah.
they're sort of become
Yeah. And
dehydrated.
you've just made a very good
Dehydrated.
point. Another outside factor, Lydia's teething at the moment.
Yeah.
So there's certain foods that she's staying away from, obviously, because it's causing pain. So she's back onto soft foods and refusing anything that's, you know, crunchy. So that's obviously going to have a connection with what she's digesting at the moment, going back to the scale.
Yep.
So that will affect the quality. So there's lots of different things that just we probably don't
Just
even think about.
Consider. No, not at all. Okay, you also mentioned we haven't even started talking about the brain yet.
Yes.
Go, because this is going to be interesting as well. And you were talking about sleep as well, so I didn't even know sleep was something that you worked with.
Yes. So yes, I'm continence, sleep, and understand. So there's me looking at my little thing that I have. That's all connected.
Okay.
So it's connected by the gut-brain connection.
Okay.
So when we're thinking about sleep, if our children are sort of waking up in the night, sometimes that can be because our children are relaxed and therefore that poo is then moving, can be poo related at sometimes, not always obviously, but it can be poo related. And then it's almost like that poo, as it's moving, it's actually moving the inside of that large bowel, and that's sort of almost like it's not scraping, but it's that sort of, it can feel a little uncomfortable for our children, and that's when we sort of have our children waking in the middle of the night, because that's sort of relaxing and that's sort of helping. So when we're thinking about that with the relaxing, but that wasn't the question. Sorry, I went off tangent, didn't I?
Doesn't matter. We're generally talking about poo, so it's fine.
Yeah. Yeah. So when we're thinking about the brain, we're thinking about that gut-brain connection. So with the brain, we're thinking about it, if you sort of think it in sort of 3 sort of stages. So you're thinking about sort of the brain stem, you're then thinking about the emotional brain, and then the thinking brain. So those sort of 3 sort of stages. The brain stem is sort of like the first part, and that would indicate, it tells us when our children are tired, they're hungry, thirsty, they need to go to the toilet, that sort of thing. and then it comes through to the emotional brain and it scans the body. Does this feel safe? Does this feel safe? It's constantly scanning the body. Does it feel safe? If there's looking for a yes or a no. So the emotional part of the brain is looking for yes or no. If it's a no, the body then goes into either a fight, flight, freeze, or fawn or flop response. So it's in a protection mode for the body. It then means that our children can't access that logical and thinking part of the brain. It's the emotional brain that is then taken over. So then when we're thinking about sleep, it then means that our children are in that protection mode. We can't settle off to sleep. Finding it with like our emotions, it can all influence in so many ways. So that's sort of where that gut brain connection sort of comes in.
Okay, so is there a connection here with meltdowns as well then? Because obviously you're just saying about everything shuts down and it's just pure emotion.
Yes.
Okay, so there's a gut connection with meltdowns on some level then?
Yes.
Oh, wow. Okay.
This is a lot to get my head around.
Way more than I thought it was going to be.
So, like,
I thought it was going to go, this is stage 1, this is stage 2, this is stage 3. There you go. Your autistic child is now toilet trained.
I can do that too, but you need to know the whole picture.
There's a blueprint.
No, this is
a
much
blueprint.
better.
So for instance, going back to kind of services and everything else like that, Lydia, renowned bad sleeper.
Yes.
Very renowned.
Famous for her very bad sleeping.
Across the land for her bad sleep. And obviously gut issues as well. So we could have been going through, it could be primarily the gut that's causing her to kind of wake up and then stay awake. Whereas when any parent goes to a paediatrician or the GP, it's automatically, let's get some melatonin into your child, which again could be, in some cases the right thing to do.
Yes,
can help. But whereas what I always look at, so when I'm supporting families with sleep, we always want to make sure, again, because I talk about, we look at that inside body first and then the outside, because if you're giving that medication, that's why some families will say, oh, it just doesn't work, and others will say, works amazing. Works a treat. But that's because we need to make sure that we've looked at the inside body, we looked at all those underlying factors, and then it can help, because it can help.
Absolutely it can help. I mean, we've had many conversations where parents have gone, it's been the best thing since sliced bread. My experience of it was not great, because she would, we know it's to help them fall asleep, and you can have slow release, whatever the case would be, but she'd be awake. But it's crazy that the automatic response is, let's not do any further investigation. Just try a couple of milligrams of melatonin. Because we're looking at the medical,
so that's where you're looking at a medical model. And for our children, that's why I sort of promote a holistic pee and poo approach, because we need to be looking inside and outside of our body. It's not just one thing. So yes, medication works, and yes, 100% that, if we need it, we need, and the same for like laxatives and things like that. If we need it, we need it.
Yeah.
But actually, there's a lot of other things that we do as well. It's not just one, and I think that's the thing.
It's not necessarily, it's not necessarily tackling the problem. It's just easing it or masking it. Whereas, as you say here,
you're treating the symptom,
we need to be
cause.
Delving, or we could be delving a lot more into this.
Yeah.
To get the child to the stage
I always
where
say we always look at the why. Why is it happening?
The why.
Yeah.
And that's an issue across the board. I mean, again, not knocking GPs, but a lot of the time GPs want to just treat the symptom rather than find out what the cause of the symptom was in the first place.
But if you if you look at a GP's a situation, they've sort of got 7-8 minutes per family.
Yeah.
And you've
it never used to be like that.
No.
And it took 7 minutes just to explain the scale, the Bristol scale. So you can,
So what if you've got? So food timing, would that be something that could be an issue prior to sleep as well? And so if a child is like having something to eat immediately before, or like drink, oh my god, milk
and cookies.
No, like if they have, like, a lot of children, they need like a bottle of milk to settle down and go to sleep.
Yeah.
I mean,
Lydia still does, yeah.
Could that be something that if they have that and then immediately go to sleep, and then obviously they're lying down?
Yeah, so it's obviously, all sort of interact, differently. I mean, the other thing, like when we're looking at sleep, is often when we're looking at sleep, we're just looking at, we go to bed at this time. It's all about the actual bedtime routine. But whereas what we actually need to look at for sleep, we're actually looking in the daytime, because it's actually the daytime that we need to look at to help regulate that body, to prepare it to be able to sleep. So if we just focus like at night time, so a lot of families will say, this is what we're doing here at this time. We actually need to, our bedtime routine sort of starts from school finishing. When you come home from school, that's, it happens even before that, but, at home.
There's a lot of stuff that you could track. This is why the Indie app is going to be really useful.
The Indie app's
because
you'll be able to
track.
It's going to be so good for stuff like this.
Track
meal
when they've
times,
eaten,
what was eaten,
sleeps, when they've woken up. What the poo was.
Yeah.
That particular time.
Yeah. So the reason I ask about timing is we've both got it, these whoops, and you can like input. It'll give you a recovery the next day, and it'll ask you like, when was your last meal, right? Yeah. And you could track loads of different behaviours and supplements that you take. And the one thing for me that gives me poor sleep is if I eat too late. So if I go to bed at like 10 o'clock, if I eat past 8 and if I've not got like a 2 hour window clear, my heart rate is quite high when I'm asleep, because I'm still digesting the food and I'm lying horizontal, and I have quite disturbed sleep then. If I give it 2 or 3 hours of no food before I go to sleep, I have an absolutely amazing night. But 9 times out of 10, I have a bowl of Cocoa Pops and I completely ruin it. But the point is, on those nights I have a really good sleep. So I'm thinking with our kids, Thomas last night brushed his teeth and he was like, yoink, I'm having these 3 sweets. And I was like, we've just brushed your teeth. But obviously you're trying to avoid a meltdown. So you're like, fine, have your sweets and go to bed. A lot of these kids are eating a lot of food and then going to bed, going to sleep. And there's going to be a lot of digestion happening while they're lying horizontal. God, there's so many aspects, isn't there, of this that could affect things.
Yeah, definitely. Yeah. That's why I find it so fascinating. Not for our children, but I think the reason I find it fascinating, not because I want to help our children, but it's more about, I can break it all down. So we're breaking it all down so we can just sort of like, okay, this is what we're looking at. Okay, right, we've looked at that. That can impact this, right? And it's almost like, yes, we can get to the root of this, and that means it's going to make a huge difference for our families.
You've done this with so many families. You must go into a situation, even if it's a completely unique situation, which I'm not sure how unique the situations are after you've done it for this long, but you must be able to pull from lots of different experiences from different children and pull different pieces into it to kind of map out something unique for that child, even though you've pulled different ideas from lots of other families that you've worked with. And it must be so rewarding.
And going back to that, just very, very quickly, just to build on that, that's why somebody like yourself, Charmaine, is so important out there, because otherwise we would all just, as parents, be handed an A4 sheet, and we'd all be following a one-size-fits-all approach.
Yeah, there's no like cookie-cutter approach to this, is there?
It doesn't work, because every child, yes, they may be neurodiverse, autistic, like our children are probably about as similar as they could possibly get.
Even though they are super different.
Yeah. But they are
similar.
Yeah, but on paper, you go profoundly autistic, non-verbal,
nappies.
You go,
but there's so much more in between all
yes,
that.
Exactly.
I mean,
that's why somebody like yourself is invaluable.
Yeah. So that's why I actually put together our support group, which is called, is that okay to say?
Yeah.
We
were going to ask you all this as well.
100%.
Yeah. So it's
in fact, sorry. Before I forget, you should join the Discord as well.
Yes.
Sorry. Carry on.
We'll come back to that.
Come back to that.
Okay. So that's why I put together our support group, which is called How to Get the Pee and Poo in the Loo. So it's got all the resources. We've got the videos so that families can watch it, like if they're up in the middle of the night, that's the only time that they need something to send them off to sleep. But why not watch my videos? That's not good effort, is it? But it's just sort of
Or watch this podcast.
Yeah. Just watch it at a time that's right for them. And then we've got the live sessions to then individualize everything. So it's not just like you say, I mean, we've got so many different like fun activities to like build the skills to help our children to be able to, do everything from wiping and being able to sort of build those muscles up as well to be able to recognize those wheeze and poos. But it's individualizing that as well, because it's not just about having the information, watching the video. You actually want to speak to someone and say, like families that come to the lives, they would just say, right, I've done that. We've done this now. Now, what do I need to do next? Okay, right. This is what we need to do next. Okay. And when you've done that, come back to me and we'll do the next bit. So it's families like it because it's just small bite-sized pieces. It's not like, here we go. Here's a whole 40 page report.
Off you go.
Good luck.
And you know this, like, as autism parents, we need everything bite-sized because we're so sort of information overloaded in so many different things as well.
There's so much, isn't there? And also, it's not saying that that's one way is going to work. It's just sort of the information we have is like, this is why this is happening, but this is how to individualize it for your child. So that's sort of,
Cool. So where else can people find you?
So more than welcome to check out our website. So it's Clear Steps Consultancy, so www.clearstepsconsultancy.co.uk. Also our Facebook, Instagram, LinkedIn, and that's down as Continence Consultant and Trainer. Purely, if anybody's out there that can help me with changing the name over, that would be great, but that's another story. But I've spent all my time helping families. I can't sort out that side of things. So it's down as
we'll open it up to a poll.
So it's Continence Consultant and Trainer. There's lots of help. I help families in so many different ways, and I think even if it's the only thing that's sort of to take it away, that actually families are not alone in this, then it's not taking it away that what they're going through doesn't matter. It's not that. It's just that there are other families that are going through this as well. And, within our group, all the families in the group will just say, at last, I thought I was the only one in my school. But actually, there's other people. You just, because it's not something you don't sort of go to a playground. Some of us don't even go to a playground, but even if you did go to a playground, it's not like, how's your poo today?
It's not what you talk about, is it?
It's not, how's the bedwetting going? No, it's all right actually. Or you don't talk about things like that. And for some of our children, they're in a transport, so you don't even get to see anybody else, do you?
See the parents? No. It must be super, super rewarding when you help these families. Like you just said, like you see a lot of tears, happy tears.
Yeah, there's lots of happy tears. That's just from me.
I'll bet. But super rewarding, I'm sure.
Yeah, I think because I know how much it means to the families. I feel like I'm on that journey with them. So, when we start off, it's, like families are saying, we've had, like sort of one of the families that are supporting, they had sort of like 15 wet underwear changes in a day. And they were just like, I just don't know, we can't go anywhere. I want to go out, but we can't go anywhere because it's just constant. And then we get to the point where it's like it's one change, and they're gone on holiday, and they'd never been on holiday because they didn't know how they would manage the journey, or it's just the bigger picture that people just don't realize unless you're in it and walking that journey and helping families, that it's not just wee and poo, it's the whole, it's so much more. It's that quality of life, isn't it? It's, I've had a family.
That's it.
Families say that, then they need to look at the toileting because the after school club has said that they're not going to be able to take their child next year. So that then means, both parents are working, and they were like, I don't know how we're going to do that.
Right.
Other families are not able to go to work because they're being called into school constantly to change their children. They want to work, and they're like, there must be another way. And they're like, there is. There is.
There is. Yeah.
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 Well, I've got to admit, I've learnt that I knew next to nothing at the start, and there's a lot more that I need to get my head round, which it wouldn't have even been on my radar.
Yeah, well,
until we had this conversation.
We've squeezed this in like just over an hour of,
Yeah, and I'm sure we could do another episode if it's okay with you in the future, where maybe we open up to questions that maybe are common questions that we've completely not even thought about. We can do another session of just a Q&A with you. Without going into too much detail on people's personal stories. That'd be...
Oh, they're the best. The Q&As are the best.
And you never know what's coming as well. That's the sort of thing.
Never have a clue.
They're the best ones.
Yeah, they are,
yeah. You mentioned the Discord.
Yes, so we've obviously got a Discord group, and we have loads of different channels in that group for various different... One of them is toilet training, which is just parents trying to help each other out. Mate, if you could join that, I have absolutely no doubt you'd get swarmed. You'd probably have to put your phone on silent, but there's loads of people in there as well. It just putting it out there might be an idea for you to join that and help a lot of the parents out. I think there's about 400 people in there at the minute or something like that. But,
just
anyway,
let me know
mate,
what I need to do. That's fine.
Well, we'll send you an invite. Thank you very much. This was way more informative. I knew it was going to be informative, but like Andy just said, I didn't know what I didn't know. Yeah. And I didn't know a lot.
No. I feel like I've got to do a lot of research. I'll be jumping on your website to have a look.
We've got lots of free downloads as well. There's lots of free downloads if people want those as well.
Perfect.
Brilliant.
Yeah. So it's like things about like the gut health and toileting, sleep, understanding emotions. So if you want to know where to start, so if people just want to know that part, then that's there.
That's amazing.
Great.
That's going to be a lot of resources. Yeah. And we'll share
all
that information 100%. As well when we start getting the information out there. So fantastic.
Great. Thank you, mate. Much appreciated.
Thank you so much for inviting me.
No, not at all. It was well overdue, mate. Well overdue.
Brilliant.
All right. Cheers, guys. Take care. Bye.
Thanks very much. Bye.